Hi everyone, this is Dr. Stefan. Welcome to interstitiallungdisease.info. In this video, I'd like to just release it before the holidays, just to give you maybe some encouragement if you are suffering with an interstitial lung disease, pulmonary fibrosis. The reason for doing this video is because I've recently attended a patient support group meeting, which was really insightful, especially for me as a doctor, because sometimes when I see the amount of difficulty that sometimes patients go through in their day-to-day lives, it really puts things into perspective. And I thought I'd like to share this with you. Perhaps you're not part of any support groups, or maybe there aren't any available in your area, but I thought I'd maybe pass on some of the things that I've noticed from the support group, some of the messages that have been sent by people who suffer with these sort of conditions. And hopefully that gives you some perspective, some insight from the patient perspective. And of course, I feel bad somehow doing these videos as a doctor, as someone who's, on the other side of the illness. Basically, I'm not dealing with the illness day to day, but I thought I'd just give you a couple of things. So one of the things that came up from the support group meeting was that there is a huge psychological impact of having pulmonary fibrosis. And it's strange because some of the patients were feeding this back to the group, that when they received the diagnosis of pulmonary fibrosis, some of them having idiopathic pulmonary fibrosis, which we know is a condition that can progress, and people may end up having extreme breathlessness towards the end of life. And it's one of these diagnoses you don't really want to receive, but once you get it, there is still plenty of time ahead to do things that you enjoy. But some of the patients were feeding back that the moment they received the diagnosis, their health really took a dive, and it was for the most part due to psychological reasons. Some people felt like they couldn't get off from their sofa. They just wanted to just sit on the sofa, not even watch TV, not do anything. And I think that's really terrible, because I think it's just struggling to accept that this condition has been diagnosed and just trying to make the most of that situation. And I think that can be extremely difficult. But some of the patients were saying that the moment they accepted that this diagnosis is there and there's nothing you can do about it, it's already done, it allowed them to focus on what they could do. And that was basically the main thing, focusing on what you can do despite this diagnosis and moving forward with this. So this was one of the very it just sort of impressed me, the level of strength the patients in the support group really were having and sharing with the others to encourage them. Some people were struggling to access all kinds of services in their local area as well, and the other patients would give them tips and support and encouragement to keep going, to try to find the right services for them. Another point that was there mentioned at some point, and I just made like a few little notes while the meeting was going on, because I thought these would be great points to share. These come from patients. So one person said that it's important to try to keep a positive mental frame, and this is difficult. It's easier said than done. But again, they were putting this in the context of life is for living. And another patient was making a bit of a joke that there are millions of people in the cemetery who would swap with you anytime. Because so these are little silly jokes, and I hope I'm not offending anyone by saying that, but it's just trying to make the most of what we've got. And I think this is a good message, especially before the holidays are coming now in 2023. So again, little things that I was surprised that people who suffer with this condition are able to make jokes about it and move forward and enjoy life. And there were a lot of suggestions on what to do to fill the time, to try to distract your mind from the suffering associated with knowing that you've got a diagnosis of an interstitial lung disease that potentially is irreversible. And people were suggesting going to befriending groups. There are a lot of charities around the world that may offer those services. I don't know the situation in your local area, so obviously it will differ from place to place, but probably just reaching out to other patients and talking to them about their own experience and what they like to do. It's interesting. A lot of people also fed back something along the lines of it would be useful to actually talk to people they don't know very well. So that's why support groups may be useful, because sometimes they don't want to worry their family about what they're experiencing, what they're feeling. So that is an important point that I never thought about before, and I'm really humbled when I listen to these experiences from patients, because it really gives you the real life perspective. And I think that's really important. Other people were saying that people should always try to go outside and fill the lungs with air, with just fresh air, because that changes the perspective, that changes the frame of mind, and people can actually have a better day just going outside for a cup of coffee somewhere. Taking a breath of fresh air might change that situation, that mood, those circling, ruminating thoughts in their head. So, I mean, overall, I just wanted to say that there are a lot of people with these sort of conditions around the world who struggle, and everyone is struggling on their own. And hopefully there will be a time when in the future, especially with these virtual meetings, videos and things like that, we may be able to be a bit more connected, especially if we're having one of these rare conditions that is quite severe. Maybe just reaching out and talking to other people online, in person, different groups, whatever the case may be, may actually be a lot of, it may offer you a lot of support. So if you are going through this problem, struggling with a diagnosis of pulmonary fibrosis or an interstitial lung disease, you don't know where to turn to, maybe the doctors cannot help you with all the psychological impacts of the condition, it's probably important to reach out and find other people to support you in your local community, church services, whatever the case may be, support groups, other patients who suffer with the condition who may understand what you're going through. I wish you all the best and a great holiday season, and hopefully things get better, or at least stay stable and you are able to accept the diagnosis somewhat and focus on the things that you can actually do. Again, I hope I didn't offend anyone by this little video, but I thought I'd feed back to you what I've heard from patients, and it is emotional for me as well to listen to these messages. And they are great messages of hope and support and encouragement. All the best and good health.